Hello, today I'll be doing CPR for toddler. So what is CPR? CPR is to the long form of the acronym CPR is cardiopulmonary resuscitation, and what it is used for is CPR is the help given to someone who is unconscious, especially those who are in accidents or drowning cases, yeah. So it is the first basic life support given to those kind of cases. So for today, I'll be focusing on the toddler. The toddler is someone who is above a year old and is less than 4 years of age. So to begin with, before carrying out CPR, you have to check for. There are a few things that you need to check for, and it is put in a method according to DRABC method or the Dr. ABC method. So, say for example, this is the toddler. The first thing you do upon the arrival at the scene is check for any signs of danger, whether the toddler is lying next to a fire or there's an electrical hazard. Yeah? And after that, you make sure that the child is not in danger, the toddler is not in danger, and you, the caregiver, is also not to be in danger if in danger. So get rid of signs of danger. Straight after that, you call for help, call for professional help. So 911 or 999 in some countries, call for help. Straight after that, you call for help, and then you approach the child. Check for responsive. That's the R part, the R. So how do we approach the child, toddler, check for responsiveness? We can do shrugging, yeah. Check for alertness, and then you can use your voice, call the toddler's name if you know the child's name, yeah, verbally, and then you can also check the pain for the pain receptors. Check the tip of the fingers, yeah. Pinch the tip of the fingers if the child responds to pain. And after that, as soon as you check for response, and if the child is responding to you, and then you simply put the child in the recovery position on his or her left side if the child responds to you. So just simply put the child in the recovery position and wait for professional help. However, if the child is not responding to you, you also put the child in the recovery position. And after you do that, after you put that place the child in the recovery position, you clear the airways, the nose and the mouth. Anything obstructing the nose, maybe be mucus or saliva or any sort of thing that is going to obstruct the mouth and the airway, you clear it. Yeah. So that's the airway. Airway is now clear. And after that, you check for the breathing, the B part. Yeah. So we've already done D, R, A is airway. Now for breathing. Continue. The child is still in recovery position, and you look for signs of breathing. Look for the chest. Look on the nose. Yeah. Look. You listen for signs of breathing by putting your head closely like this. Yeah. And then you feel for any signs of breathing. If the patient is breathing, then continue to place the child in the recovery position and wait for help. However, if you look, listen and feel and there's no signs of breathing, you gently turn that child over, supine position, and then you tilt the head, lift the chin, and open the mouth, and then you give 2 rescue breaths. Yeah. So the difference between this and an infant is that you pinch the nose, close the nose while giving the breath mouth to mouth only, and not giving the breath to the mouth and the nostril. So you give 2 rescue breaths. So 1, 2. After you give those 2 rescue breaths, and then you look for any signs of circulation. Yeah. If this is how you look for signs of circulation. You look on the skin of the face, yeah, and you look on the chest if there's movement, any signs of breathing, yeah, and then also you can check the pulse. You can check either the carotid or the radial pulse, and if there's signs of breathing, place the child back again in the recovery position and let him or her to recover while waiting for the help. However, if you've given the 2 breaths and there's still no signs of response, the child is still unresponsive, there's no signs of breathing, no signs of circulation, yeah, then you move on to do CPR. Now CPR is basically giving compressions and 2 breaths continuously. As soon as you start CPR, you're not allowed to stop. The only time you stop is when you when doing CPR and there's signs of life re-emerge or professional help arrives. The difference between infants and a toddler is that for infants you use your 2 fingers. Now for toddlers you use the crease of the palm or the heel of the palm. Yeah, and still on the central nipple line, just beneath the central nipple line, you give 30 breaths. 30 compressions. Yeah. Remember, the child is unresponsive. You've gone to the DAR-ABC, and then only you can proceed on to CPR. So this is how we do. You go. While doing this, you also have to stabilize the head of the toddler. Yeah. So 30 compressions before 2 breaths. 1, 2, 3, 4, 5, 25, 26, 27, 28, 29, 30. Then you reposition the mouth. So head tilt, chin lift, and then give 2 breaths. 1, 2, and then you give another. Then you continue with it, and then you check for signs of life. Check for signs of life if there's any circulation. If not, continue with the CPR. So you continue with the CPR. Yeah. As soon as the CPR starts, you continue with the 30 pounds, 30 compressions. Yeah. 1, 2, 3, 4, 5, 6, 25, 26, 27, 28, 29, 30, and then give 2 breaths. Yeah? Pinch the nose, yeah, mouth to mouth interface, and then give the 2 breaths. Yeah, 2 breaths, and then you continue with the CPR. This is how you do for toddlers. You continue with the CPR until professional help arrives. If not, the other way you can stop CPR is if you do the CPR and there's signs of life, then you can also stop CPR. If not, CPR shouldn't be disrupted. It shouldn't be discontinued. It should continue until help arrives. And another thing is that if you suspect that the toddler is suffering from an injury on his or her spine, it is advised that you should not move the tilting of the head. You shouldn't apply much pressure there. Yeah, so tilt gently. I think that's it. So basically, just go through Dr. ABC, and then if no signs of life appears, then do CPR. And if CPR is done, and then you see signs of life, you feel there's pulse, there's change in the skin color, and there's breathing, chest movements, you can stop CPR. If not, continue with CPR until professional help arrives. Thank you.